Hello and welcome to my presentation for UDAE7002 UTPT7002, Supporting Healthy Dance Practice. This presentation will focus on burnout prevention in pre-vocational dancers as part of the student learning experience. Firstly, this presentation will examine dance science theory about burnout, including its definition, symptoms, causes, and prevention. I will then outline an implementation plan I have constructed for my practice and reflect on its potential effectiveness. For this presentation, burnout will be defined as a multidimensional construct defined by the experience of mental and physical exhaustion, cynicism, and the devaluing of one's activity participation. Various theorists use different terms interchangeably for burnout, such as overtraining or staleness, chronic fatigue, and central fatigue. Some theorists solely focus on the physical effects, while others examine burnout as a holistic, multifactorial issue. Furthermore, it is crucial to look holistically at a dancer and consider burnout's psychological and physical elements, recognizing the interconnectedness of the mind and body. My rationale for exploring this topic stems from my anecdotal experience teaching pre-vocational students who often suffer from burnout. I teach the Imperial Society of Teachers of Dancing syllabi in Imperial Classical Ballet, Modern Theatre and Tap Dance in local dance schools, where many students aspire to careers in dance. Through dialogue with my students, I have calculated approximately 75% of my students aged 16 to 18 years wish to audition for vocational dance training. This coincides with a period in their life with increased academic demands, GCSEs and A-levels. These students often perform in dance competitions, shows and associate programs, thus creating multiple demands and potential stressors. I have noticed that students frequently articulate and/or display signs of burnout, including exhaustion, loss of enthusiasm, and increased injuries. Therefore, this presentation aims to recognize the causes of burnout and how dance teachers can prevent it among their pre-vocational students. Di Pasquale studied burnout in a liberal arts program and discovered that much research exists on pre-professional and professional dancers, but not in other educational contexts. Similarly, there is limited data available for pre-vocational dance students, which could be an area that would benefit from further research to improve the quality of dance training in this age group. The symptoms of burnout can vary between individuals and are hard to reliably diagnose. Symptoms may include fatigue, depression, anxiety, anger, irritability, disturbed sleep and eating patterns, diminished enthusiasm, frequent respiratory tract infections, excessive sweating, inability to recover optimally following intensive dancing, a breakdown of technique, poor concentration, and increased susceptibility to injuries. A key indicator of burnout I have noticed is when students who purport to want to pursue a career in dance lose their enthusiasm, joy, and intrinsic motivation for it. The causes of burnout are multifactorial and therefore complex. Elkland and DeFries recognize burnout as a biopsychosocial model of potential stresses in athletes. Similarly to athletes, Simmel identifies potential biopsychosocial stresses for dancers in this diagram. Illnesses, which I will also combine with injuries. Contrasting with much research, Liederbach et al. Argue that burnout is characterized by an unexpected drop in performance that cannot be attributed to illness or injury. This is where the terminology variance may provoke confusion. Theory suggests that burnout may not always be easy to pinpoint as it is so multifactorial. Therefore, it may not be caused by a singular case of illness or injury, but by a prolonged lack of recovery from illness and injury. It is common for dancers to experience frequent respiratory tract infections due to the lowering of the immune system in the timeframes subsequent to heavy training sessions. Parry, Billings et al. Discovered that the increased training load decreased glutamine in plasma, which is crucial to the functioning of the cells in the immune system. This leads to a weakened immune response in physically burnt out athletes. Upper respiratory tract infections are common among my pre-vocational students. They often attend dance classes with symptoms because they worry about falling behind if they rest instead. The prevalence of injury among dancers is widely documented. Steenberg et al. Found that 42.6% of 8 to 16-year-old recreational dancers have suffered injuries, and this rises to 86% of pre-professional dancers. Lower limb injuries are prevalent among dancers. Literature suggests stress fractures are particularly common. However, whilst I agree with lower limb injuries being prevalent, I have seen some stress fractures among pre-vocational dancers, but rarely. I notice far more sprained ankles and knees than stress fractures. Damaging inferred narratives in the dance industry can exacerbate injuries, such as dancers should dance through the pain and no pain, no gain. Similarly, when dancers continue to dance with respiratory tract infections, I often see pre-vocational dancers wanting to rush back to dance after injuries out of fear of missing out and falling behind their peers. Physical strains. Regarding poor training plans, pre-vocational dancers are usually the oldest dancers of a dance school. Their classes are typically scheduled later in the evening, often finishing at 9 p.m, which is prime time for injuries due to fatigue. Mitchell and Clements also comment on how dance demands can consume most of an adolescent dancer's week, leaving little room for other activities outside of dance. Complementing this research, the timetable shown demonstrates an example week for a 17-year-old student. She attends her classes highlighted in yellow and works for the dance school teaching the younger students highlighted in green. Work commitments will be discussed shortly. As you can see, it takes up most of the week, with 2 days to rest. The myriad events young dancers can be involved in can see performance demands being virtually year-round. Here is a performance schedule for the same dancer showing performance demands almost throughout the academic year from October through to August. Unfavorable lifestyle. Studies have discovered that older adolescent dancers slept fewer than 8 hours a night, below the 8 to 10 hours recommended for teenagers. They also have poor nutritional literacy. In pursuing perfection and the ideal physique for dance, dancers can follow misinformed dietary advice from peers on the media, which could lead to disordered eating. Deficiencies are also prevalent in dancers, particularly vitamin D, which can negatively impact muscle and bone recovery following training or injury. Fortunately, I haven't been aware of disordered eating among my current students. However, I do see evidence of poor dietary choices. Most students prioritize ease over healthy meals and prompt for microwave meals during breaks, complementing theory on poor nutritional literacy. Although I'm unaware if the other unfavorable habits affect my students, alcohol and nicotine use can be a concern for dancers' health, particularly with the rise in vape use amongst teenagers. Emotional stress. Examining the emotional stresses of CIML's 2014 model, pre-vocational students can experience high stress levels due to the increased cognitive load when studying for academic examinations. In one of my current classes, out of 8 students aged 16 to 18, they all have academic examinations, mock examinations, or coursework during this term. Additionally, this load could be increased if they have a part-time job, as discussed in the example student. In the same class, 3 students out of 8 also have a part-time job. Anecdotally, I have had students report having a part-time job to support their dance training and commitments, which could be linked to stress over their financial situation. Whilst family, friends, and teachers can provide a positive support network, they can unintentionally become an extra stressor for these young dancers. Sometimes I've noticed family members exacerbating examination stress by applying pressure on young dancers regarding their academic success. Emotional stress caused by a dance teacher or trainer will be discussed in more detail shortly. The diagram by CIML identifies many external stresses contributing to emotional stress or extrinsic factors. However, there are also intrinsic risk factors for adolescents as they experience significant cognitive, physical, and psychological transitions when approaching adulthood. Literature on the treatment for burnout suggests either moderated participation in dance or complete rest for anywhere between 6 weeks and 4 months. Moderated participation could involve program alteration, meaning extending studies or limiting training hours and/or intensity. Surgener argues that burnout prevention is far more effective than treatment. Prevention will look different for all dancers because every dancer will have a different propensity towards how much training they can cope with before burnout occurs. This presentation will now focus on how burnout can be prevented with a psychological focus. Sports science research suggests a link between ego-involving climates and burnout in young athletes. Therefore, I aim to explore how a task-involving climate can prevent burnout in young dancers. A motivational climate is the psychological atmosphere of a training or performance situation and reflects what you value as an educator. Competition among dancers can lead to emotional stress, mainly when a motivational climate is ego-involving, where success is defined as demonstrating a superior ability to others. Dancers may implicitly or explicitly perceive their peers as their competition. Alongside competition and comparison, dancers can struggle with perfectionism, which can cause further emotional stress. A task-oriented student's perception of achievement can be defined by mastery of a skill or task. Task-oriented students demonstrate intrinsic motivation, focusing on the learning process, not the outcome, and typically value working hard and trying new things. Dance teachers can significantly influence students' perceptions of the motivational climate within a dance class. Therefore, dance teachers should value progress over natural talent. This can be promoted in many ways, such as by providing positive feedback and emphasizing that mistakes are a fundamental part of learning. The benefits associated with a task-involving climate in dance suggest that it promotes excellence without an excessive focus on achievement. The basic psychological needs of autonomy, competence, and relatedness are supported by a task-involving climate. It promotes positive well-being and self-worth and decreases anxiety. In my practice, the motivational climate varies significantly between dance schools and teachers. I notice ego-oriented climates more in high-achieving schools where dancers participate in many performances, competitions, and examinations than in dance schools where participation is more recreational. Norden-Bates suggests goal setting as another way to promote a task-involving motivational climate, particularly SMART goals. SMART goals are a goal-setting system designed by Doran in 1981. The definitions of the acronym vary, but for this task, SMART goals will be defined according to this table. Specific. Is the goal specific enough that you clearly know what you want to achieve? Measurable. How will you know when the goal is reached? Autonomous. Does working towards this goal make you feel autonomous, like yourself? Realistic. Does the goal feel like an enticing but realistic challenge? Time-bound. Have you set a date time by which the goal should be reached? Grounded. Is the goal grounded in you, in line with your values? Organize. Have you written the goal down? When, how will you evaluate progress? Adjustable. Remember to stay flexible, adjusting goals and/or tasks as needed. Logical steps. Have you broken long-term goals down into several short-term goals and set more process, performance, and learning goals than outcome goals? Supported. Have you shared your goals with peers and teachers? Referring back to the goals mentioned for the logical steps, process, performance, learning, and outcome goals, the latter focuses on longer-term aspirations, such as succeeding at an audition, and is typically associated with ego-oriented students. Students will likely have little control over whether they achieve these goals, so it is more beneficial to break them down into the aspects required to achieve that outcome. For example, I will work on my stamina to perform the audition piece without getting tired. In my practice, although I haven't set a goal-setting task previously, students occasionally verbalize goals, such as wanting to get a distinction in their next examination. This suggests an ego-oriented goal, often leading to students putting excessive pressure on themselves and burnout occurring and diminishing performance. Therefore, I have constructed a SMART goal-setting plan for implementation in the new academic year with an intermediate TAP class of 16 to 18-year-old pre-vocational students. As shown previously, these students have many performance demands alongside academic and work commitments. In their pursuit of success in all these endeavours, I often see ego-oriented behaviours emerge. Furthermore, exploring the potential connection between a task-involving motivational climate and burnout prevention will be meaningful for them. As dance teachers influence the motivational climate, consequently, I propose that this implementation plan could positively impact the students' learning experience. Students will be tasked with setting a psychological skill-related goal. There appears to be a lack of literature on SMART goals with a psychological focus, which suggests this could be an area for future research. For this task, psychological skills will be defined as strategies or techniques that can support peak performance and well-being by regulating one's thoughts, emotions, and actions. Scavala and Clement's study on vocational dancers discuss the benefits of the psychological skills of mindfulness and relaxation practices. Likewise, I believe these practices will also benefit my students who are almost the same age as pre-professional dancers and experience many performance, academic, and personal demands. Not for them to undertake during our classes, but to support them beyond the studio, educating them holistically. Depending on prior experience with mindfulness and relaxation practices, this may be challenging for my students. I have not explored these practices with them during their classes, so I'm unsure of their experience. To further explore their psychological skill-related goals, I have created a YouTube playlist as a resource to support them in their exploration, because my students, like most teenagers, engage frequently with social media. They can construct their goal at home during the first week of term using the playlist and SMART goal handout to support them. This playlist incorporates coping strategies, breathing techniques, yoga for dancers, and meditations by psychologists, healthcare institutions, and eminent dance and yoga practitioners. An example of a psychological skill goal could be, I will practice a mindfulness meditation 4 times a week until the end of term. To follow the SMART goals acronym, students will be time-bound T. Goals will be set to be achieved by the end of term. They will be organised O, by writing the goals in a journal, and supported S, by sharing with me as their teacher and their peers during discussions. Time is an implication I am concerned about in this goal-setting task. Parents and guardians paying for dance tuition often have certain expectations of what service they are paying for. Therefore, exploring and constructing these goals at home will save contact time in class. Another potential implication is student willingness to partake in the task, as it will not be overseen. I'm not concerned with this student cohort because they have always proven conscientious, but this may need further consideration with other student groups. Every week following the initial goal setting, goals will be measured by a review and rating process, which follows the rating discussed by Nord Bates in 2022, which is a scale of 1, did not do this at all, to 5, did this often. Students will rate and comment on their weekly goal progression to provide quantitative and qualitative data. I will allow 5 minutes for this at the end of class because it is crucial that with only a 1-hour class, it doesn't take too much time out of their syllabus learning to meet parent-guardian expectations. Post-class, I will also record burnout symptoms in accordance with the symptoms presented earlier: signs of possible fatigue, signs of possible depression, anxiety, anger, irritability, signs of possible diminished enthusiasm, signs of respiratory tract infections, signs of breakdown of technique, signs of poor concentration, signs of injuries, and details of those injuries. I will tally results and note injuries whilst ensuring all data remains anonymized to protect student safety. I will report any relevant concerns to the appropriate safeguarding officer, acknowledging my remit as a dance teacher, not a medical practitioner who can diagnose or treat these conditions. To ensure goals remain adjustable, a half-term check-in will be conducted. I will facilitate a short group discussion to assess progress and the appropriateness of goals to support any adaptations where necessary. I will ask students, how is everything going so far? And how is the goal setting process serving you? After this class, I will ask students to submit the journals to monitor their goal progression. I will record student review and rating data to obtain quantitative and qualitative data. Then I will provide written feedback and further suggestions to help students achieve their goals. Weekly reviews and ratings will continue for the second half term. Then, during the final class of the term, students will be asked to reflect on the goal-setting task and write down answers to the following reflective questions. Did you find the SMART goal-setting task beneficial? If so, how? Did you find the SMART goal-setting task challenging? If so, how? How did it affect your motivation during class? How did it affect your motivation outside of class? Do you think the SMART goal-setting process helped you achieve your psychological skill-related goal, and why? What would you like to explore further during our next SMART goal setting? I will then facilitate a group discussion during which students will be welcome to share their reflections. I will collect their journals to retrieve all student data and provide constructive feedback to support students in future goal setting. I will analyse the rating data and student reflections to assess the efficacy and validity of the goal setting process. In addition, I will analyse the symptom statistics to determine any trends. Finally, I will also perform my own reflections during the half-term check-in and at the end of the term, using Gibbs' reflective cycle. As the final part of Gibbs' cycle, action plans will be generated to take forward and explore in the future, whether in class or further research. Hypothetical reflections. I assume symptoms may peak around increased performance demands like shows or competitions. Unfortunately, I do not have a schedule for the new academic year yet. However, I hope the symptom trends suggest that this implementation plan prevents burnout. I presume students may find setting psychological skill-related goals challenging, as they will likely have less experience because goal setting in dance typically involves technical or expressive skills. In asking the reflective questions at the end of term, I hope to get an insight into the perceived motivational climate of my classes by asking students about their motivation. This may transpire naturally or require more explicit conversations with students, which could be limited by students feeling they have to appease me or other dance teachers at their school in their answers. Therefore, I will encourage honesty in their feedback throughout. Future considerations for teachers. As discussed, acknowledging our remit as dance teachers is essential when engaging with psychological skills. We are not psychologists or mental health specialists, therefore we must signpost students to appropriate practitioners when necessary. Our practice must be guided by relevant dance science literature and conducted within the scope of our expertise. Also, I have yet to see goal setting tasks incorporated in non-formal educational settings. Therefore, I advise dance teachers working with pre-vocational dancers in similar settings to ensure the dance school owner grants permission to conduct this plan. Fortunately, I work for owners who support creating a holistic student learning environment. However, some teachers may encounter pushback from owners or stakeholders if they cannot comprehend the purpose or benefit of goal setting for students. Despite this, I believe dance educators should challenge industry practices and be open to change. As the introduction mentions, looking at the dancer holistically and appreciating the interconnectedness between the mind and body is crucial. Teachers impact the motivational climate, therefore teachers must critically reflect on their practices and values to avoid ego-involving climates that could inadvertently contribute to burnout. Fostering a task involving motivational climate will require more teacher input than solely a goal-setting plan, such as approaches to feedback. I hope to see more research on the implementation plan of psychological skill goals. I also look forward to seeing the results of this implementation plan and utilising the results to improve my practice further and support students in preventing burnout. Here are the bibliography slides. Thank you for watching.